For the longest time, early in my career and before my career started, we had these laws that were against the corporate practice. They prohibited the corporate practice of medicine. What does that mean? It means non-doctors, non-physicians, non-healthcare providers could not own medical practices. It means you couldn't get a plumber to own a dental practice. You wouldn't want your landscaper to own an acupuncture clinic. Basically, you had to be trained in healthcare to own a healthcare practice. And there's been so much violation of those laws and changing of those laws. And what I see is that if we don't get on top of this, it's going to be one or two companies. United Health Group is one. United Health Group, not United Healthcare. United Healthcare is just a subsidiary of United Health Group. You're going to have a company like United Health Group owning and running every bit of healthcare in this country. They're already buying up doctors' offices. I feel like this is a huge conflict of interest. We do for some very specialized wound care. One of my providers goes out and does a wound care in the home and does some very specialized advanced wound care treatments. And we found out that another company that does these things is owned by Blue Shield. And I thought, wow, that's a big conflict of interest. If Blue Cross Blue Shield is owning a company that is then billing Blue Cross Blue Shield, then I don't know, that seems like a big conflict of interest to me. And I am worried that if we don't get a handle on the corporate practice of medicine and go back to where doctors are able to make decisions that they feel is the best thing for patients, then we're going to be in a world of hurt more than we already are. Some people are going to come on here and say, well, there's crooked doctors. Yes, there are. I don't know what to tell you. There's crooked hairdressers. There's crooked electricians. There's crooked everything, all right? And yes, we should have some regulations that helps prevent that. But if we don't let the healthcare providers start making decisions about patients' health and we just leave it up to the profit makers, it's just going to get worse and worse and worse. It's already that way. It's just the speeding up of that and the buying up of healthcare practices and sort of controlling the entire food chain, so to speak. It's crazy right now. And if we don't rein this back in, I think we're in worse trouble than we are now. I'm Dr. Dave Morris at Magnolia Medical Center here in Murfreesboro, Tennessee. Let me know your thoughts below.